Hey gang, thanks for tuning in to Travel Nursing with Trace. Today I've got a great video for you. It's the pros and cons of travel nursing. So whether you're already a travel nurse or you're considering becoming a travel nurse, the number one pro I have for you is pay. Pay is king. Cash is king anywhere you go. And by travel nursing, you're going to make 3, 4, 5 times more than you normally would as a full-time staff nurse somewhere. So just remember that, if you have a lot of bills to pay and you're really looking to make money quick, travel nursing is the way to go. The second pro is flexibility. You can pretty much choose anywhere you want to work. I like to take time off between contracts. So taking 2, 3, 4 weeks off between contracts is no big deal when you're a travel nurse and you kind of set your own times for travel. It's like, I like being my own boss. And by doing travel nursing, I kind of feel like I have a lot more control over what I do. I can take a surgical center position or a hospital position, level 1, level 2, level 3 trauma. It doesn't really matter. I kind of get to call the shots. So flexibility is a great pro. The third pro I have is constant change. I get bored really easily. I'm always looking for something new or fresh or whatever in my professional life. So having the ability to leave after 13 weeks is wonderful. I get to go somewhere new, meet new people, start a new contract, make more money. So the constant change is a great perk. Number 4, the travel. Travel nursing is all about traveling and travel to great places and see new things and meet new people. It's a fantastic way to see the world, really, or at least the United States. I have a compact license, so I get to go pretty much anywhere in the U.S. I've seen the Grand Canyon, which I never thought I'd get to see. It's beautiful. I've seen plains and hills and mountains and ocean, and it's just been a fantastic experience. So the travel is really the perk. If you're someone that maybe they're not interested in traveling too far away from family, there's always local travel contracts. As long as you're within 51 miles, I believe it is, of a location, you can still get the stipends, and that's fantastic. But you don't have to be. You can be 30 miles away and not get your stipend and get to go home every night, but still make more base pay than you would as a full-time staff nurse somewhere. So traveling locally is an option as well. Number 6, you get to stay out of all the hospital politics, and you don't have a lot of projects that you have to do on a regular basis to kind of climb that nursing ladder, so to speak. So staying out of the hospital politics and just moving on to new places where you don't have to get wrapped up in that. You just go in, you take care of your patient, you collect your check, you go home. That's what it's all about. Number 7, meeting new people and seeing new places. We kind of talked about that in travel, but we didn't talk about the people or the culture. The culture is different in every state. They have different things that they like to eat, different restaurants, different stores that we don't have back home in Texas, where I'm from. And meeting new people and getting to hear the accents, that's wonderful. I love that. So meeting new people and seeing new places and eating new foods that I've never eaten before, those are fun things to do. Broadening your skill set. That is most certainly what's going to happen, because you have to hit that floor running. You're going to have to learn different electronic medical record systems like Cerner, Meditech, and Epic. I love me some Epic. But you'll have to learn a lot of different things that you wouldn't normally learn if you were a full-time staff nurse, which is going to make you more marketable if and when you leave travel nursing. And not even that, just being able to do all these different things makes you a more marketable travel nurse as well. Now on to the cons. And if you like this video, please smash the subscribe button. It really helps me out a lot. It helps get this video out to other people just like yourself. The number one con, in my opinion, is housing. I've got a great place now. It's very comfortable. The bed is wonderful. The house is clean. Everything works. There were towels and pillows and sheets and just kitchen supplies. Just name it. It was there. But but this is an exception here in Omaha. The last place I stayed, there were no sheets, no towels, no bedding. The crime rate was high. I had my house broken into. It ended up being right next door to a nightclub that the lady didn't tell me was there. So loud music every weekend, plus the helicopters for the hospital flying overhead all night long. It was a nightmare. So make sure that when you find a place to stay, I use furnishfinders.com, not sponsored. I just happen to use them. Make sure you ask the questions. Hey, are there any loud nightclubs nearby? What's the crime like? How close am I to the hospital? Am I underneath an airport traffic pattern? All these little things. Just ask the questions. Are there towels, sheets, blankets, pillows, toilet supplies, cleaning supplies, kitchen supplies? Do you have to bring your own pots and pans? But anyway, housing, that can be a problem. Number 2, competition. A lot of people are moving into travel nursing just because of the money. The money's fantastic. Well, not just because of the money. Some of them want to see the world, like I said, but competition's out there right now, and you have to move fast. If there's a contract that you like, you have to really work fast. When it's offered to you, accept it quickly, because there are a lot of people that want the same contract. The third con is basically the way people treat you. They know that you're not there very long, and they don't always want to just invest the time that it takes to get to know who you are. So sometimes you're just treated like, someone passing through, which you are. So kind of keep that in mind. They see people come and go all the time. They just want you to come in and do your job and do it well. The number 4 con would be orientation. I've had orientations last 4 days, 5 days. I've had orientations last 4 hours. Don't be afraid to ask. If you don't feel like you got all the orientation that you need to be safe and get through your day, ask for more. That's why you're there, to work hard and be successful. Don't let anyone set you up for failure. Sometimes I think that they do the 1 or 2 hour orientations just so they can check it off their list and say they did it. Number 5, charting systems. The multitude of charting systems. This can also be a pro. We mentioned it before. It broadens your skill set, but it can also be a real headache. And when I say headache, Cerner comes to mind. I hate Cerner. Just hate it. I'm an Epic guy from way back, so that's what I favor. In fact, I've gotten to the point now where if a contract comes up, I ask, what EMR are you using? And if it's not Epic, I don't take the job. That's just my personal preference. So, kind of know what you're looking at when you go in. Know what you're going to be using. You can YouTube some videos on how to use the system so that you can at least get an inkling of an idea of how to maneuver around it. 6, depression and separation anxiety. When I leave my family, I get very lonely. I love my wife and my kids, and I like to be at home sleeping in my own bed. But I do this because I know it's helping us out financially. But separation anxiety can be a big deal. That's why I like to keep myself occupied at all times. That's why I started this YouTube channel. Number 7, when you're offered a contract, you have to move quickly. Packing can be a big deal, especially if you just got off of a contract and you're having to pack up and leave again. So that picking up and moving over and over and over can be a real bummer. So just know that you're nomadic at this point. You're going to be moving around. The next one is job security. Surprise, there is none. When you're travel nursing, you can be canceled the day of your contract. You've rented a room and you've packed everything up. You've done everything they told you to do. You've taken all the tests. You filled out all the paperwork, and you get a call or you get someone tapping on your shoulder and saying, "Hey, I'm really sorry. We're not going to be able to use you after all." This happens, and it's a big problem, really, if you experience it. I have been very fortunate. I haven't experienced it, but I've met many people who have. And the last con I have is just the way that you're treated sometimes by surgeons, anesthesiologists, the hiring manager. I have been treated really great at times, and I've been treated like garbage at others. Remember, you're there to help them, and you're not a piece of trash to be kicked around. Well, that concludes our pros and cons. I hope that was helpful to you. Again, please smash that subscribe button. It helps us out a lot. Leave comments if you think that we missed anything or you'd like to see certain videos on certain topics. I would love to be able to do that for you. Again, thank you very much for tuning in to Travel Nursing with Trace, and happy travels.